Welcome back. In China, cases of human metapneumovirus, also known as HMPV, are on the rise. It started to affect India and the UK, but will it spread here in North America? Dr. Zane Chagla, Co-Medical Director of Infection Control at St. Joseph's Healthcare, joins us with more. Thanks for being here, Doctor.
No, thanks for having me.
Good to see you. What is HMPV?
So this is one of the respiratory viruses that circulates during the season. We do see this. This is something that has occurred in Canada for many, many years. We check for it with our routine testing. And, during the season that we see from December to about February, we do see cases increase. Relative to other causes of respiratory illness, it's probably number 4 or 5, so it's not the typical one that causes people to get sick, but definitely is a virus that we know of and can lead people to be hospitalized occasionally from being ill.
Okay, so we already have this around here. Is this going to be like the new COVID?
No, I think what we're seeing right now globally is just as, COVID or isolation, how we were not together and how these viruses are re-emerging after COVID, we're just seeing some atypical transmission patterns. Some countries seeing more, some countries seeing less. Thankfully, our local statistics suggest that we're having a fairly normal season as it relates to human metapneumovirus.
Okay, so what's going on in China then?
Yeah, that was a country that had a longer lockdown, much stricter lockdown. They are starting to see some of these viruses reestablish themselves that we saw in 2022 and 2023. And so, again, this is where these atypical patterns happen. We've really never stopped transmission like this of viruses before. And again, I think the next couple years we're going to deal with some irregularities as things start to establish themselves again.
Right. What are some of the symptoms?
So this presents typically like a cold, so cough, fever, runny nose, congestion. We do know in people that have underlying diseases like heart disease or lung disease, this can often make them a bit worse. And then occasionally when we deal with it in hospital, we're really just treating people supportively to get them through the infection.
Right, okay, so kind of like the common cold and flu.
Absolutely.
So let's talk about some other respiratory viruses more in our neck of the woods here. The Canadian Respiratory Virus Surveillance Report says that RSV, influenza, and COVID are on the rise right now. How can people protect themselves?
Absolutely. So, important. We're talking about human metapneumovirus, which is a small percentage of what's happening in Canada, but those 3 viruses are a large percentage of what's happening in Canada. So you're much more likely to get one of those. And so the typical things still apply. Washing one's hands, considering wearing a mask, particularly when one's ill, staying home when sick. And we do know for all 3 of these viruses, for particular age groups, we have really good vaccination. So RSV vaccinations for older individuals and for young babies. We have influenza vaccines for all ages and COVID-19 vaccines for those at risk for severe COVID-19 outcomes.
And yes, now there's the new RSV vaccine for infants.
And this program is launched. In fact, St. Joe's and McMaster, we've been giving every infant who's born an opportunity to get this. And, those who are catching up on the year have an opportunity to get their vaccine as well.
And Doctor, I just want to ask you quickly, because we know these tummy bugs have been going around this year. We've heard a lot about norovirus. Can you tell me why this seems to be more prevalent this year?
I think we're reporting a lot more. There is some post-pandemic changes as well. But this is typical for this time of year. Norovirus is called winter vomiting disease. And so it's winter and unfortunately kids are vomiting. But again, this is well established at this point in the year. We are picking up a little bit more because post-COVID, we really do want to define these illnesses a bit better, especially when they come to hospital or they're in long-term care settings. We really want to get to a diagnosis.
Absolutely.
But this is, again, a good one where just good hand hygiene, especially with soap and water, good cleaning and monitoring your child or your loved ones for symptoms is important.
Excellent. So good hand hygiene, keep up with all the things that we learned during the pandemic.
Absolutely.
But good news, HMPV not going to be something that we should be too concerned about.
Absolutely.
Excellent. Thank you so much for joining us, Dr. Zane Chagla.
All the best.
Thank you.